My name is Stephen Alder. I'm the Chief of the Division of Public Health in Family and Preventive Medicine at the University of Utah School of Medicine. I'm also the President of the Academic Senate this year. As part of public health, we have been engaged in collaborations with partners in Ghana for the past 10 years, where we have joint research projects, joint teaching, we have learning abroad programs, and we have a lot of exchange of information. It's changing every day, so this is something that we're keeping close eye on from multiple perspectives here at our university, both because we have a healthcare system, because we have a big campus and people who are working around the world, and because we have folks who are traveling on behalf of the university. But we're watching that very closely. I mean, it's heartbreaking to see what's happening in West Africa, and it's heartbreaking to see what these health systems, which are challenged, are now having to do in terms of facing this outbreak. Good to see folks that are becoming more involved in helping to try and turn this around. That we would have a major outbreak like they're seeing in West Africa is really not there. We're really in different circumstances, but if there are ways that we can help, I think we need to think about that as a country, and being part of our role as being global citizens, but also, diseases like this and wide outbreaks can have a destabilizing effect in regions, and so. Whether it's from a compassionate humanitarian point of view or from a security point of view, it's important that we support efforts to turn this around. First of all, the easiest thing we can do is we can become aware of things that we could do and things to watch for here. On the University of Utah's website, there's a button that says Ebola information or something close to that. It's a blue button, and it has some very good guidance. Dr. Swaminathan, who's the chief of our infectious disease division, has a letter on there and some recommendations. We have a terrific travel clinic, for instance, that is well suited to help us understand if there are concerns, or if somebody feels that they might be at risk or they're concerned about their own health. So we have great resources here. And as we think about our contributions, we certainly want to be supportive of efforts that are being done by people who are well trained, because it's important that involvement is done by people who have expertise in both care and taking appropriate precautions to avoid acquisition of infections. And then using our scholarship, and as I mentioned, we're going to be doing some work on helping to expand this idea of how communities can become engaged in the solution for disrupting the spread of the disease. And so those are things that we can do kind of as an institution, and certainly being supportive of people who are going over, who are part of those groups, whether it's a military group or a medical group or another sort of public health group. Over time, it will depend on how long this continues. Right now, we've not seen the resolution of this outbreak, and so we have to wait and see.